The following is a study guide for the Activity Coordinator Fall Prevention Certification exam, and while not every question is specifically stated in this guide, all the information covered in this exam is discussed and explained. In other words, you must have a good understanding of the information presented because I will not simply teach the test. So, if you're ready, let's get started. Hi, I'm DeLoriea, former world champion and two-time national champion NASCAR pit crew coach, and I've been asked to share some of the proper techniques for lifting heavy and awkward objects. Before I do, though, we need to look at the anatomy of the human spine, buttocks, and upper legs to see just how they work. A better understanding of our own anatomy will help make sense of the techniques for lifting residents in and out of wheelchairs and beds. You see, back pain due to overuse is generally a combination of poor lifting technique, weak, and imbalanced core muscles. Overuse can be lifting an object that is too heavy or lifting an object too many times. Either way, it overuses muscles and causes pain. The muscles in the upper leg keep the knee tracking properly to provide proper balance for the body. The back of the thigh is made up of three large and strong muscles. These three powerful muscles counterbalance the four major muscles in the quadricep in front of the thigh. Keeping the muscles of the upper leg in balance protects the lower back. If the quadriceps are not trained properly to balance the strength and the tightness in the hamstrings, the bicep femoris, the semitendinosus, and the semimembranosus muscles actually pull through the gluteus muscles to stretch the smaller muscles in the lumbar area, overpowering the abdominal muscles, which causes the lower back to arch and the pelvis to tilt. Wow, all of that's happening just because your hamstrings are too tight. So what's all that mean? Well, simply this. When the back of your thigh is so tight that it overpowers the strength of the front of your thigh, it's able to pull a curve in your lower back, which causes pain and could cause injury. This often causes very severe and acute pain. This condition can also cause the vertebrae and the discs of the lumbar spine to impinge upon nerves that run down through the spine into the back of the legs. This condition is called sciatica. To adequately protect the low back from overuse injury, one should stretch the lower back and hamstrings while strengthening the quadriceps and the abdominals. Proper core training such as Pilates and yoga are proven to bring about the needed strength, stretch, and overall balance, which should relieve undue discomfort due to normal stress and strain. The first exercise is called a plank. We're going to do it on a stability ball because that's what's going to work our core section and strengthen the abdominals and the low back while working the quadriceps and the hamstrings at the same time. All we do is get in a push-up position on the physio ball and just hold it. Now, if you can do it for 30 seconds, that would be wonderful, but most people can't. So just do it until you can't do it anymore, or 30 seconds, whichever is longest. Already I'm starting to tremble and shake because my core is really working hard. The next exercise is just laying flat on the floor and lifting your pelvis toward the ceiling. It goes like this. And you'll be able to see how this works the hamstrings, the quads, the abs, and the low back at the same time. It's a great exercise. Okay, you want to bend your knees, bring your feet almost up to your butt. You just want to put your hands on your chest and just lift your pelvis. Lift your butt off the floor. This helps strengthen the pelvis so that you can bring it back into alignment, kind of a pelvic thrust. I'm pushing off my heels and I'm lifting my butt, squeezing my butt muscles. For the next two stretches, you have to get down on the floor. These are great for the hamstrings. If you don't have loose hamstrings, you're probably going to have a pretty tight lower back. I mean, it's just pretty much a rule. So we have to keep these loose. We have to stretch them out. Whether you do it at home or you find a place off to the side at work, you have to do these, especially as we get older. The first one is a karate stretch. You pull one foot right up into the groin, you tip one heel back and toe up, and you just lean your pelvis forward. Now we're not bouncing, I'm not pulling unduly. If you want to pull, you can just reach out and grab your calf or your ankle. Don't pull hard. Hold it for about 15 seconds, and then switch legs. Now you'd want to do this, 3 or 4 times. So you're looking at just 2 minutes worth of stretching. Surely you can find 2 minutes of stretching to help your lower back and your hamstrings. It feels good. The next one is similar. You can stay right on the floor. Take your right foot, put it on the opposite side of your left knee, your left arm on your right knee, and just twist like a pretzel. Look all the way around behind you. Hold it for about 15 seconds, and then switch legs and arms. That's very good for the lower back. Just exhale, relax. That's great. Then you're back to work. Because of our hurried lifestyles and limited budgets, we tend to ignore symptoms in our bodies. Symptoms like pain in our knees and hips, tight muscles in the legs and back, stomach problems like excess gas and indigestion, sciatica and headaches could all mean that we're close to sustaining an overuse injury. These symptoms are the body's way of telling us that something's wrong and needs to be fixed before it breaks down. Symptoms aren't normal. They're like the car's check engine light, and it's much easier to live healthy than it is to get healthy. But with a few simple exercises and stretches, you can be on your way to a pain-free and healthy lifestyle. Ignoring symptoms could end up with shifts in the spine that cause spasms, torn muscles, hip pain, burning in one or both legs, or worse, disability. In the event of a true injury, however, it would be wise to consult your medical doctor. At that point, your doctor might choose to refer you to a physical therapist and chiropractic care. Physicians grade overuse injuries based upon the symptoms and impact upon performance. This grading helps to guide the treatment and rehabilitation process. Grade 1 is when there's no pain with the activity, but there might be some discomfort either immediately after or during the evening and following days. Grade 2 is when there's some discomfort while doing the activity, but it really doesn't interfere with performance. Grade 3 is when there's more than just some discomfort with the activity, and this discomfort interferes with the performance even when body mechanics or the form is corrected. Grade 4 is when the discomfort is so intense that the activity can't be performed at all. I know, all this is great, but what do you do if your back hurts? Well, treatment guidelines for grade 1 overuse injuries is usually reducing the intensity or the duration of the activity by about 25%. That's all you need to do. Activity can be gradually increased as symptoms allow. A runner, for example, should never increase his or her weekly mileage by more than 10%. And in the same way, an assembly line worker should gradually increase his or her production to avoid re-injury. Sudden or excessive overtime is a surefire recipe for overuse complaints because the workers just don't have an opportunity to build up their endurance prior to the extra work. Now, the way we deal with grade 2 overuse injuries is to reduce the intensity or the duration of the activity by about 50%. In addition to using ice and stretching, consider using a non-steroidal anti-inflammatory. Physical therapy can be considered, but it's not absolutely necessary at this point. And when the pain is gone, have a trainer teach an endurance and an eccentric strength program. Now, when it comes to grade 3 overuse injuries, we have to do something called active rest. That means we should stop doing the offending tasks, but still move the affected part during daily activities. Physical therapy is used to speed up the recovery process as well as rehabilitate. That means we should strengthen, increase endurance, and restore coordination as well as proprioception. In addition to the oral nonsteroidal anti-inflammatory, a corticosteroid injection may be considered. Now, with grade 4 overuse injuries, we have to completely rest the affected part. This usually involves some sort of sling or splint. Even casting is considered in severe cases. If the injury fails to improve or the condition recurs despite adequate treatment, then surgical intervention might be required. Alright, so what can we do about it? Well, unlike sports, there's no off-season for workers to recover from a season of overuse, and there's no preseason to warm up prior to beginning employment. Industrial athletes perform all year round. Therefore, it's very important to emphasize a continued flexibility program. Otherwise, the tissues will be tight with reduced flexibility, which will make it easier for the microscopic tears to occur, leading to injury. Only after tissues have achieved a certain degree of flexibility should a strength training program and endurance program be initiated. Starting strength exercises too soon will often result in a worsening of the condition. So your low back is at risk of injury, or at the very least you're having some pain. Doing the exercises and the stretches I gave you should alleviate a lot of that. If you still think you're injured, please go see a doctor. Don't wait. Here's a couple of fun little videos I put together for you just to show you what a healthy back and good core can do for you.